UC Health is recruiting for a rare drug abuse study involving pregnant women and treatment that could weaken withdrawal.
It could also spare their babies from addiction and maybe bulldoze one massive roadblock to recovery called stigma. Here's reporter Larry Seward.
The bond between mother and child, threatened by addiction and opioid withdrawal so strong that the national rate of newborns in hospitals with complications grows higher and darker every year, tracked by the U.S. government. Kentucky is among the states struggling the most. UC Health's Addiction Sciences recently launched a 20-month study, Anything But Ordinary.
Medicine's typically not tested in pregnant women because I like to be extra careful. So that can limit the options that we have for treatment.
Usually, patients take oral doses of buprenorphine under the tongue, but side effects for daily use on pregnant women and their babies bring higher risk without calming withdrawal symptoms. Of Hamilton County's 37 overdoses in the last week, more than a third are women. Therapists say survivors with babies usually run into stigmas before recovery.
They're also, unfortunately, I think, a group that gets more discrimination than the average person who's suffering from substance use problems, because there is some added expectation that if you are pregnant, you should be able to stop using.
It is personal for Dr. Christine Wilder, who sees her own pregnant patients struggle. So, armed with funding from the National Institutes of Health, her team plans to try weekly shots of buprenorphine. For the next 20 months, they will deal doses to 25 women in the tri-state and 300 more around the country. Their involvement is confidential. The results are not. Other addiction counselors are eager to see the study's findings, even if the shots don't work. As long as UC Health's study was valid, it is a step toward answers their pregnant patients need.
If they are successful, then they have great success for themselves and also for their children. So you've got this time of life where making a difference is really important, not just for one person, but for a whole family. So it's not just kind of a theoretical study. It's something that will really have a big impact.
In Clifton, Larry Seward, WCPO 9 News.